Good afternoon, everybody, and welcome to this Contact and NNPCF webinar today. We're also doing this one in conjunction with colleagues in the National Health Service, so more about that later. Before we launch into the webinar proper, there's just some housekeeping that we need to go through with you, so bear with us for a little while whilst we do that, and then we'll get on with the webinar itself. If there's a technical hitch, please do bear with us. And if you're joining by laptop, PCs, tablet or smartphone, you should be able to see this slide. There are lots of attendees today. It's a very popular webinar. So we won't be taking verbal questions. And so all the attendees will remain on mute throughout the webinar itself. If you have got any questions, there is a question icon on your toolbar, your GoToWebinar toolbar, and you can click on that question mark, and then those questions will pop up for us here, and we will try and answer as many of them as we possibly can in the time that we've got. What we're going to try and do is take questions at the end, but please do post your questions as we're going through, and we'll try and answer them at the right point. If there's any questions that we're not able to cover today, either we don't have the information or that we run out of time, then we will get back to you on those. And at the end of the webinar, there'll be a short questionnaire, which be really grateful if you can complete that. It doesn't take very long, and that's really powerful for us in helping to shape future webinars. So with that done, let's move on to the webinar itself. So let me introduce myself. So I'm Mrunal Sisodia. I'm the East of England Steering Group member for the NNPCF, and also one of the co-chairs. I'm also going to introduce you to the person who is going to be leading the webinar today and doing most of the talking, Mary Busk. Now, many of you will know Mary Busk. Mary was a founder member of the NNPCF, so she's very much one of our own, from the Redbridge PCF. And we're really fortunate that Mary is currently working as in the NHS in the Learning Disabilities and Autism work stream as a family carer advisor. So we've got one of our own very much in the heart of the learning disability and autism work that's going on in the NNPCF. Mary.
Okay, thank you very much, everybody. It's good to be here to talk to parent carer forums and parent carers about the work we're doing in the National Learning Disability and Autism Programme within NHS England. As Mrunal said, I was appointed a few years ago as a family carer advisor to do just that, to give the views and ensure that the voices of family carers are heard in our work. So the subject today of our webinar is talking about the NHS long-term plan, and particularly what it says about children and young people with learning disability, autism, or both, in their families. And I think the key message to take away is that there's a much stronger national, regional and local focus on these children and their families. So the agenda today, I will tell you a little bit about population data, so you get a sense of the scale and nature of the group of children and young people we're talking about. Also go into some of the detail of what's in the NHS long-term plan in the learning disability and autism part of that. Talking a bit as well about building the right support and transforming care. That is a really important aspect of our work. And then going into some of the particular details in the long-term plan and how you might have heard of those in your local areas. To talk a bit about what we are saying about co-production. And then talking sort of in a technical sense about local system plans, how and where you might have heard of them, and then some questions for yourselves. So I won't go into the detail of all of this population data, but we work with people who do know a lot about population data, and we consider it very important in planning and thinking about the needs of our children and young people and families, to understand the number of children and young people we're talking about overall. So there are, we've got the data of the number of children and young people who have special educational needs and disability, 1.3 million. And then we know also a breakdown of those who have more complex needs, who have education, health and care plans, those with profound and multiple learning difficulties, severe learning difficulties, autistic spectrum disorders, 27,500, and those with multisensory impairments. And I think we also know that there has been a rise in those with complex needs in schools by about 50% in just over a decade. And a lot of this work's been done by the Council for Disabled Children and someone called Anne Pinney. So we work very closely with Anne in understanding the population data. The actual number may well be higher than these numbers. We explain in slide 2. And also we've identified that there are gaps in the school census data. So for example, those who have education, health and care plans in independent schools, which are likely to be, you know, some very complex young people, are not included in that data, 13,500. And also those who are 16 to 25 years are also not currently included in the school census data. So this is important sort of context for what we're talking about. So I know that you've already had a webinar with Marunal talking about the NHS long-term plan and giving you an overview. So I don't intend to sort of go into that today, but these are just sort of pictures of the key documents that I know Marunal's referenced and spoken about at length: the NHS long-term plan, the NHS long-term plan implementation framework, and the NHS long-term plan framework system support offer. So these are the key source documents for what I will be talking about today. Now, this is a slide that we've developed and we use a lot with all of our stakeholders because it explains within the long-term plan what our key ambitions are at a glance for learning disability and autism. It is a huge agenda. It is an agenda that looks at providing a much better start in life for children and young people, to improve the health of young children and young people and adults with learning disability and autism, to provide much better care, including in inpatient mental health settings, and also overall to improve quality. And in our work area, these themes sort of frame how our learning disability and autism programme is sort of structured. So I won't go into all of these because some of them I've got slides on later. So for example, tackling the causes of morbidity and preventable deaths in children and adults with learning disability, the leader work, the commitment to make investment in intensive crisis forensic community teams, working to improve access to and reduce the length of stay for, or the length of waiting times for autism diagnoses, the commitment to a designated key worker for certain groups of children and young people and their families, the digital flag, which I don't cover a lot here, but there is a commitment to introduce a digital flag and summary care records so that it's known and understood who has learning disability and autism and what their need for reasonable adjustments is. Improving the quality of care, I'll talk a little bit about that, and the reducing the need or the use of restrictive practices. I'll talk as well about hearing, sight and dental checks for children and young people in special residential schools. And I think as well at the bottom across, we talk about and we see these as our themes. So, you know, the personalised care, you know, having the workforce and having the right skills and capabilities and capacity. Co-production is a key theme. Hearing people's voices and understanding the STOMP stamp work, which is about reducing the need for over-medication. And there are also changes to the way that mental health commissioning is going to happen, something called provider collaboratives. And there's also quite a big commitment in our work to employment and increasing the employment opportunities for those with learning disability and autism. You may have heard a lot about, or some about, personalised care and support. So this is very much a sort of theme that runs through all of the NHS long-term plan. It says that this is the way that all health and social care services should work. And our personalised care group have written a plan to make clear how this should happen. So I think it's something that you should be asking about, how it's being implemented in discussions you're having, and making sure that it's something that is very much on the agenda. So in the next slide, I've got sort of a diagram that you might find a bit hard to read, but this is sort of how it explains, personalised care and support should work. So, very much recognising that the key elements are shared decision making, personalised care and support planning, the importance of choice, the link to social prescribing, supporting self-management, and the need for an understanding of personal health budgets. So this is something that really needs to be integrated into local planning, commissioning and development, so that it informs practice in relation to everything that's done. I just wanted to say something about, so Maruna knows about this. This is some of our internal governance structure to show how the work we do in the Learning Disability and Autism Programme for children and young people links into the work of the Children and Young People's Transformation Board, and also into the work, because we are also part of other stakeholder boards and groups that you may also be aware of. So the middle diagram shows the sort of governance within the Children and Young People's programme, and the children and young people are part of that in particular. So it shows that we are and have set up, or are setting up, a cross-system group to take account of all of the work that we do throughout the elements of the long-term plan. That group will sort of inform our input into the Children and Young People's Transformation Board, which also has a number of other areas of priority that relate to children and young people. And additionally, we're very linked into and part of other groups like the DFE Send Leadership Board, the Transforming Care Stakeholder Group, and other important work, the Quality Task Force relating to the quality of inpatient care and support. We're linked into the National Safeguarding Group within NHS England, and Health and Justice. I want to say that we in one of the orange boxes that is to the side of the Children and Young People Steering Group, we have a parent participation forum, and that is very important to us, and has been a very important part of developing everything that we've put into the NHS long-term plan, and holding us to account in how we're delivering that. So that's a really important part of our commitment to co-production, and I co-chair that group with my colleague David Gill, who is an autistic person, and he is one of our learning disability and autism advisors. There may be some changes to the structure of this governance, but this is where it currently sits, and it's important, we felt, that you understand how we sit in relation to wider work.
And I think the key messages from our point of view are very much that co-production is at the heart of this, and one of the big messages that we're giving at the NNPCF across this is the cross-system working element of this is absolutely key. That all of these groups, there are lots of them, but they have to work together if things are going to improve for our children.
Okay, so this is, some of you may know this as Transforming Care. The underlying policies were actually the documents that set out what Transforming Care was all about. So you may have been involved in your Transforming Care partnerships, but the underlying documents and policies were actually known as, and are still known as, Building the Right Support. So there are very specific commitments in the NHS long-term plan about reducing those who are currently in inpatient settings for adults and for children and young people. There is also a commitment that the length of stay for people who are in these settings needs to decrease. Finding the right housing and support solutions are very much part of this work. So you may be involved or hear about regional or local housing discussions as part of Transforming Care. I know there's one coming up in one of the South regions. So I think, and we must also, as part of all of this, and we have a specific commitment to developing community teams for children and young people based on good practice that's evidenced, like, for example, the Ealing model. So I don't know if any of you have know about or have seen the Ealing model, but it's very much a caring, person and family centered model that gives children and families the right support at the right time in relation to, you know, direct intervention and support, but also support in the family home and in relation to short breaks, really reflecting, you know, the high levels of needs that families can have and the high levels of support. So that those are specific commitments that are being worked through in relation to, you know, regions and local areas as we speak. So this is the national guidance that I mentioned. This is additional to, it's been around some time, building the right support, transforming care guidance. There is guidance for children and young people as well as for adults, and really it sets out what the principles are, that it needs to put people and children and families at the centre, and really says to local areas and transforming care partnerships, ICSs now, where they may become that they need to follow this guidance, to use it and see families and people at the centre of it. So I put this in, I actually was speaking recently at a social work event and we talked about this, and in some ways this is really at the heart of what building the right support and transforming care was all about. These are the 9 principles of the service model, and this is at the heart of it. So the child, young person, families at the heart of it. And it's really about, you know, the child, the person having an enjoyable life, you know, care and support that's well planned, choice and control about my support, my family and staff get the help they need to support me to live in the community. I have choice about where I live and who I live with. I get good care and support from mainstream health services. I get expert health and social care support in the community. I get help to stay out of trouble with the law if I need it. And if I need to stay in a mental health hospital because of my mental health needs, it is of good quality. And I would add, and you don't stay longer than you need to. So I think that really gives you a sense of what's at the heart of building the right support and transforming care. It also gives you a sense of how important personalisation is to understanding the needs of these young people and their families who have, you know, very complex needs. And I think, you know, I feel that diagram really sets out what it's all about without having to wade through all of the policy documents, which are obviously also important. As part of the transforming care commitment and building the right support, it was recognised some time ago that existing mechanisms, so for example tribunals or CPA reviews within the mental health system, weren't sort of perhaps working as well as they should for children and adults with learning disability, autism or both, in making sure that their needs were met and they got out quickly. So care, education and treatment reviews were introduced some years ago. The education element was introduced in the children and young people's policy about 3 or 4 years ago, recognising the importance of education for children and young people, regardless of where they are, that is a fundamental right, but also recognising that in the complex lives of children and families, sometimes that had got missed. And we felt that was wrong, and that's why we, in relation to children and young people, call these reviews care, education and treatment reviews. So this is just to let you know that those policies are also, you know, available on the NHS England website. I hope you know of them already. Indeed, some of you may be experts by experience working as part of care, education and treatment review panels. But we've committed as part of the long-term plan to reviewing these policies to make them easier, more person-centred, to ensure that the reviews themselves reflect the critical importance of being of very high quality, knowing about how well a care, education and treatment review has been done, to learn more about the quality of people's care, education and treatment. And my colleagues within the Learning Disability and Autism team have been working very hard on co-producing a revised policy that has been tested in each of the regions. So that's something to look out for, and we can make sure it's shared through your networks, through Marunal and the team when it issues. I also wanted to say something about the significance and importance of the seclusion and segregation learning. So we know from family carers about these issues. Family carers have been bringing these to the attention of the media and others, and as a result of that, we held an internal review within NHS England of the needs and presentations of some of the children and young people. The Children's Commissioner issued a report, as have the Care Quality Commission, and they have another report that is due to come out. So this relates to, in particular, the experiences and what happens in inpatient mental health settings for those with learning disability and autism. And I'll just share sort of a headline of the key learning points. So I think we have to acknowledge that a disproportionate number of children and young people with a learning disability, autism or both, are experiencing periods of seclusion and or long-term segregation. And there are definitions of these terms within the mental health legislation. Personally, I think it's perhaps the guidance. I think it's just recognizing that this has become something of a mainstream experience because the services, the reasonable adjustments, the understanding of these disabilities hasn't been as good as it needs to be. The pathways of most children and young people, so the review, for example, that we took out internally, and I was part of that, for most children and young people demonstrate extreme challenges in accessing appropriate early support, mental health support, social care support, short breaks. And almost all of those children and young people had experienced exclusions from schools and other settings, often multiple exclusions. Many had significant delays in their discharges, and outcomes during the care were poor. So there's a number of national responses to this. The Children's Commissioner-led task force that NHS England are leading into improving quality. There's a Baroness Hollins is leading some independent care, education and treatment reviews for children and adults of those in experiencing seclusion and long-term segregation. And there's also been an announcement of 6 to 8 week commissioner visits and host commissioner arrangements to make sure that commissioners have a much tighter understanding and actually meet the people that they're commissioning the services for, to make sure that they are safe. So this is just a quick overview of the commissioner oversight visits, every 6 weeks for children, 8 weeks for adults, building better relationships with the patient, ensuring human rights are respected. So this is something, listening to frontline staff. There has already been issued guidance to commissioners about these requirements. There is new guidance being issued that is emphasising the importance of listening to and hearing the voices of people and families and children. And again, when that issues, we will send that to you. But this is already very much on the agenda. Commissioners have already had, guidance about this, and there is more to follow. So, as part of your dialogues with CCGs, with other health commissioners, it's something you can ask. You could ask, and really this thinking and planning should be feeding into the development of those early support, early help services in local areas, so that this does not become a destination for the children and young people, that they can stay in their communities and that they don't need to be sent away out of area for what can be long periods of time. There is also, as I said, a commitment to key working. It's a very specific commitment. I know a lot of you may recall key working from before. It came out from the Dame Christine Lenihan report. These are our children, and we picked it up from that. So the commitment is for children and young people with learning disability, autism or both, and the most complex needs. So key worker support will also be extended to children and young people with multiple vulnerabilities, such as looked after adopted children and those transitioning between services. So we've actually, in the group I mentioned, the first place that this team who are working on this came was to our parent participation group to get the views of families directly, families who've had children in inpatient settings, those who have really struggled, you know, the national network and other family carers. So that's the first place that this team came to hear the voices of families, and the voices of families have been very much at the heart of this work as it's been developed. So we now have worked with the Council for Disabled Children and others to develop a sort of a framework for delivering this new function, and trials will begin in each region within this year. So as soon as we know more about that, we will share it with you. The STOMP stamp work is really important. So I don't know if you know that this whole issue of over-medicating and over-medication of people with a learning disability, autism or both, that tends to start in childhood. And the STOMP stamp program of work, which again, you know, involved national network members and, you know, families are a huge important part of this work. You know, recognizing that it's not to say medication is a bad thing, but it's to say that over-medication is not something that should be happening. And the STOMP element recognizes that the importance of allied health professionals, those therapies, speech and language therapy, occupational therapy, and understanding and supporting those aspects rather than medication being given in the absence of therapeutic interventions and support. Autism diagnoses are also seen as really important, and there is work going on to test the most effective ways of reducing waiting times for those. And there's also a commitment to developing support for children and young people with autism with other neurodevelopmental disorders throughout, during and after including ADHD, throughout the diagnostic process. I can't say more than that at this stage because the team that are leading this work are just being formed, but some of the work has already started, and it's important that you get to know more about it as it develops. So this is something that has very much started. I've been working on this. It's really important. The work came from work by Seeability, a very important charity working in special schools in London. They found out that children with learning disability, autism or both, have enormous needs in the area of eye care, but most of those needs had actually never been identified or met. They've done a lot of research. They made the case. That case led to this work coming into the NHS long-term plan and also being extended to teeth and dental care and also ears. So the aim in this is to bring checks to children and young people with learning disability, autism or both in special residential schools. And that's actually what the NHS long-term plan says. So there may be scope within some areas of this work to extend that to all special schools, but in relation to what the long-term plan commitment is, it is to special residential schools. So this is a really big and important piece of work. It's a huge area of health inequality, a huge area of unmet need. I guess for me as a parent carer, the sadness is that, you know, existing available services in these areas are not necessarily always available to our children and young people. And this is, you know, to address that, to look at pathways, you know, to ensure that those inequalities, the need for reasonable adjustments, the needs of these children and young people are absolutely understood and met. So we have a sensory stakeholder group that the National Network are very much part of with other families, and we're building and developing this work together. The first thing, or one of the first things we've done is we've commissioned guides for families to help them understand the importance of these areas for your children and young people. Those are being co-produced. We want to co-produce a lot more work for families and for children and young people, and that's something that we'll be working through in co-producing the communication plan within our stakeholder group. But work with schools is beginning this year in relation to eyes and hopefully teeth and ears as well. So again, we'll keep you posted about all of that. Annual health checks. So annual health checks already exist. There's a lot of research evidence that shows the absolute value and benefit of these to improving the health of children and young people and adults with autism, with a learning disability. They don't yet apply to autism, and the plan is to test a specific autism check. But obviously, if your young person has a learning disability and autism, then they would be included. The aim is to increase the eligibility of those who are having the health check to 75%. And we are working now in my team with colleagues on a pan-England campaign to help achieve the target, including helping parents understand how they can help with this as well, building on work by Contact and the NNPCF. So Lynn, I don't know if you remember Lynn. Lynn did some work. I was part of a webinar with her, but there's going to be new work commissioned, very important work, and that will be launching quite soon. I wanted to say something about the learning disability mortality review, the leader work, and the link in that to mandatory training. So all the deaths of children over 4 and adults with a learning disability must be reviewed. CCGs are responsible for leading this work in their areas and leading from it. So they should have a leader group. I would hope that they would be reaching out to, to forums and helping to make sure again that the learning from this critical work is integrated into planning and development of services. So I've just put here a link with sort of some of the themes from the Government Department for Health and Social Care response to the 3rd leader report, which has just been published, and really to sort of look at some of the themes, because I think this sort of tells you a lot without even delving into the detail of the report about the importance of transition. This work has shown that transition is a big risk area for children and young people with learning disability autism, or both, in relation to avoidable and preventable deaths. There's also a big focus and need to include Black and minority ethnic families, because they are seen as a big risk area for children and young people and transition. Listening to families is also a huge theme. If you talk to families who've experienced avoidable and preventable deaths, they will say that they were not listened to, they were not heard. And so that's a huge theme that has really got broader relevance across all of these areas of work, including SEND, that you listen to families, you learn from and understand and hear the voice of families. There is a need for priority programs of work which have been identified, including, sepsis and other things, constipation, the whole big theme around service and care coordination, transition again, the whole issue about transition and how that needs to ensure that the needs of children and young people with complex health issues are not lost and their health does not deteriorate as a result of that. And also this whole issue about bias, the fact that they found that there were instructions being given not to resuscitate people because they had learning disability and autism, simply for that reason. And there have been instructions sent out to the system and to Royal Colleges about that not being acceptable. So I've provided the link for that latest response to that report there. There's also some really interesting, I was able to input, there's also some really interesting issues about the use of language and the different use of language between education, health and social care in relation to learning disability and autism. So that's a big area of interest in particular for me, but I think it might be something, and it is reflected in this report, and I think it's again something that it may be of interest to raise locally about how it's understood, the difference between the learning difficulty, the learning disability, autism, and how all of that's planned for and understood in relation to local population data. So from all of this, one of the recommendations was that there needed to be, from an earlier leader report, there really was a need for mandatory training. And Paula McGowan, a wonderful mother who sadly lost her son Oliver, has championed this part of the work. And so now we have a commitment to the Oliver McGowan mandatory training in learning disability and autism. That's how it's going to be known. The commission for this work has just issued from Health Education in England, looking for organisations to deliver this. I've also included the link to Paula's story in relation to Ask, Listen, Do, and how her not being listened to and Oliver not being listened to led directly to his avoidable and preventable death. But I think for me, in all of this, as I've said, it's really important that children and young people are the focus of this training, and also that families, so working positively with families, is understood as a really important part of this training as well. So I guess the message really comes across that we must identify and end health inequalities for children and young people and adults with learning disability, autism, or both. We have to acknowledge, as the long-term plan does, that they experience more health inequalities than other groups. They're still dying too young. They're 4 times more likely to die from treatable causes. 70% of autistic people are said to develop mental health problems, and suicide is a leading cause of premature mortality for autistic people. People face, and this is children as well as young people and adults, face social, educational and communication barriers. Many people are in specialist inpatient settings for far too long. It makes them much more vulnerable to neglect and abuse, as we've seen, and family carers often feel powerless and excluded. So as part of recognising this issue about not hearing the voices, I was actually recruited as a family care advisor to work on something that has become Ask, Listen, Do. And that is at its very basic level, it's saying conversations need to count with families, with children and young people, in health, in social care and in education. The NHS Constitution in relation to health says that everybody has a right to good quality support. It also will mean doing things differently, recognising the Equality Act rights of those with learning disability, autism or both, so that and the need for reasonable adjustments. But you can't hear people's voices and listen to and make those reasonable adjustments and get it right if people are not listened to, understood, or are not able to raise a concern, complain or influence services. And that in itself leads to health and social inequalities. So this is what we used when we talk to organisations. We say it is their moral and legal duty to stop it from happening.
And the comment from me is that I think this is absolutely core to the basis of the Children and Families Act, and it's absolutely core to the messages that we as the NNPCF have been giving to decision makers, which is essentially listen to families and intervene early. And if those 2 things happen, then I think we can head off a lot of the problems that are in the system at the moment.
Yes. So, and I think that in the work we've been doing with Ask, Listen, Do, I haven't put it on here, but I can share it. We have a call to action that was signed by 12 organisations, including the DFE, Ofsted, CQC and others, because I think it recognises that sometimes families and parents can be seen as difficult and troublesome. And we have to recognise that, and that is a bias and a problem in the system that must be fixed. So I've just got some examples that I've used to help when I go out and talk about this work, to help people sort of see, practitioners, organisations understand feedback and compliments in the context of, expecting early and local resolution in relation to health, education and social care. It may help you sort of reflect or understand what you know yourself, what you hear from families, and to put it in this context of feedback and compliments as part of a system of how organisations and practitioners listen to hear the advice of families. So within education, the issues around not making a fuss about those school trips, that homeschool communication book working really well, going to that college that will really meet my needs. That's all feedback that people should be listening to and acting upon. Within health, the reasonable adjustments about double appointments or not waiting, those are some examples. And in relation to care, about activities, if you have young people, as I do, in a residential school or college, I don't want to go to bed at 9 o'clock. I want to sit up and watch TV. I say that for my son. He can't say it for himself. We are concerned about the lack of contact with our family member. So these are all things that, you know, I've sort of put into this framework to help see how feedback is so important in relation to listening to voices.
And I think from our point of view, again, this very much chimes with some of the messages that we're giving, which is that the expectations of parent carers and families when it comes to what they're looking for their young people are absolutely and completely and utterly reasonable. You know, parents and carers do not ask for unreasonable things. It's just that when those reasonable requests aren't met 3 or 4 years down the line, you're going to be faced with an unreasonable request, a quote unquote unreasonable request that's a lot more demanding, simply because things have escalated.
Yeah. And I think, you know, I've put at the end some resources. We produced a resource with Whole School Send on schools, and I'll just talk about some of it, but just to add to that. And I think really all the families wanted was to be heard. You know, they wanted the communication book to work. They wanted to talk about the trips. They wanted to talk about the speech. It was really basic things that they felt they weren't heard, and then things just escalated. So this is just something I sort of have produced to sort of show how the individual issue, you know, may lead to an organizational response or lack of response in your local area that may show something that is actually a structural problem. And I think it can show also how it can be really hard for that individual, either through feedback or a concern or even a complaint, to get that solution, because there is something structural. So, you know, you need some speech and language therapy. Oh, it isn't on the local offer. Well, maybe, you know, there aren't any enough commissioned, or, you know, it's so there's a structural reason. And I think it's important local areas understand that can't get a blood test. That's one of my themes. My son finds it really hard. The phlebotomy service hasn't, it's not accessible to someone with learning disability autism. And actually the structural reason may be that a service that is reasonably adjusted has not been commissioned. And we know this is an issue because this came out in working with the Waltham Forest Forum in relation to BARTs. So that was one of the things they asked for. Can we have a blood test? Well, they haven't been commissioned. So we've, you know, BARTs have had to look at doing that. But that is a major problem, actually, just even that simple thing of blood tests. It's also come out through LEADER. Lack of transition planning on the local offer, lack of information, confusion as to who does what. You may actually find it's the real reason is there's a lack of joint commissioning and lack of joint planning. Families are worried about the quality of care. The organisational responses were not welcome. There's a lack of clarity about safeguarding. It could be that there are issues about, it may well have a good CQC rating, but it gets into these issues about, you know, there's lots of different local authorities and nobody's really reflecting well on the quality of the care. The college excludes as they can't meet the needs. The routes of regress for that young person may be unclear and are expensive. And the local authority don't see it as their problem, and the young person sits at home losing his opportunity for a good life. So just really a pitch to use. All of the resources are free. You know, it's something that you could maybe integrate into your messaging in relation to your local authority areas. Because if you can't hear people's voices, you can't co-produce with them. You can't hear their voices, you know, so co-production and hearing people's voices, having the skills, understanding how those voices are reflected in feedback, concerns and complaints is a really important part of organisational listening and reflecting. So as I say, co-production is key. That is very much part of our message. And I quoted here, I took this actually from Maruna's last presentation about the long-term plan, what the long-term plan language actually says about co-production in relation to services for children and young people and learning disability and autism. Systems should involve people with lived experience and their families in checking the quality of care, support and treatment, and set out how they will ensure local services make reasonable adjustments. That the learning disability and autism part of the long-term plan also specifically talks about using Ask, Listen, Do to improve experiences. So this is information for you to use to ask your local systems and services and commissioners how they're doing this across education, health and social care. So these are, we've actually further developed in my team. It's not something that's formally published yet as an NHS England document, but I wanted to introduce you to it. Measuring you're getting things right in relation to co-production. And again, you know, feel free to use this, but at a strategic level, there's a commitment to co-production, a named person, making sure it happens across all you do. deciding and checking quality together, how to do that, co-produce with the people with the right experience. So, for example, within health, that it's not just, that they're actually talking to children and young people with autism and their families and people with learning disability and not other patient groups in relation to our services, and making reasonable adjustments and not seeing people as being difficult or demanding, because that is your legal entitlement. So then I'll get on to, again, I've taken this from Marunal's last presentation, the local system plans, needing to have a senior officer responsible to oversee implementation of the long-term plan for learning disability and autism, needing to set out in these local system plans how proposals align with plans for mental health, SEND, children and young people service and health and justice, setting out a local offer for learning disability and autism, and obviously that could lead and link very much to the SEND local offer, and then capital investment for the development of housing options, and that links to, to building the right support and other things, but also it leads actually to proper and good transition planning. So now we've come to the Q&A part. And I'd put in a few questions, but I'm also happy, I'd put in a few questions for you, but also very happy to take questions that you've been asking on the system.
So we've had a few questions posted already, and so maybe if I can just read those out to you, Mary, and we can have a look at those. So how does the education element of CETR join up with EHC plans?
Well, I think that in the initial policy, they should be integrated and linked, but it was felt initially in relation to the first policy that we wrote that it would be very hard to do an EHC plan justice in a CETR review. So it's very much that they should be integrated. Certainly a CETR is a time to check the status of the education, health and care plan, that it is accurate and up to date. If proper reviews have not been happening of that plan, then they need to be scheduled and planned for, and those should be actions that are flagged and made as significant in the CETR recommendations.
But I think the key thing for me is that there's clearly, as Mary described, clearly a link between the two, and that,
yes,
that there's often, it may all be that you are in a CETR situation because EHCPs have not, what's in the EHCP has not been executed well, but they serve a different function.
Yes, they serve a different function, but they are absolutely linked, and the E is in there because the people who are responsible in the SEND team, for example, or even the school setting where someone may be going back to, for example, in relation to community CETRs, it'll be really important that the right people from education are there at the CETR. So the SEND team, which I've seen, people from the SEND team there, or the school setting, and where that works well, they will be an integral part of making sure that all of the education elements and all of that is properly and fully integrated.
Sort of next question, how are rates of persistent absence for children with autism and learning disabilities monitored, and how, as they also miss out on support and isolated as a result of long-term absence from school, often for reasons related to their SEND and their needs, frequently go under the radar? So essentially the question is, is there anything around linking to the rates of absence for children with learning disability and autism?
I mean, that's something I guess it might be worth asking the DFE about, but we do know that work, the Timpson review was a part of the system acknowledging that there's a big problem here, and giving a course of action as to what needed to happen. So I think that I think that's a really important point, that it absolutely should be in local areas, knowing that also families shouldn't be getting the education welfare officers chasing them up, which I know often happens, and that instead, the system should be, looking at this whole issue of, exclusions, all the different types, informal and all of that, as well as wider absence issues, and whether that may actually be a covering up of what is a form of exclusion. So I can't answer exactly how that data is collected, but And perhaps that's something to, to ask for maybe more information from.
Yeah, what I can say from the NNPCF point of view is that there's two things here. Firstly, exclusions data is collected by reason for exclusion and also characteristics of exclusion. So we do know nationally how many people are being excluded because of SEN, how many people who have SEND are being excluded. But as Mary hinted at, we think that's just the tip of the iceberg, because there's a lot of unofficial exclusion going on, and that's almost a greater concern, because that's going on, as you say quite rightly, it's going under the radar. The next question I'd like to take, we've had quite a lot of questions, so forgive me, I'm going to try and theme them and try and pull out the ones that we're most commonly being hit upon. A simple one here is, should GP practices be proactive in offering 14+ health checks?
Yes, absolutely. And the new campaign that I was mentioning, there are behind the scenes work going on to look at the content of those checks, the incentives for those checks, how GPs can better understand the importance of those checks. And in some areas, they do that, but there just needs to be increased, much greater uptake and, commitment to them. So there's a huge amount of work going on to help make that proactivity happen more, but also by working with families and young people to ensure that they know more what to ask for and to expect, and to have that dialogue with the GP about where the health check is and how important it is, and what barriers that might need to be overcome to ensure that that happens if it doesn't happen well already.
There's a couple of questions here which are linked to essentially the provision of services, the availability and provision of services that if I may, I'll take. One around social care and one around speech and language therapy. Just simply saying, they're just these services, they're just not enough of them available, that they're difficult to access, and there are just not enough therapists, for example, when it comes to speech and language therapy. I think this is a well-recognised problem. I'm not sure that this is one necessarily for this webinar and for Mary, but if I might comment on it from the NNPCF point of view, we've been making the case now for a couple of years that SEND services are underfunded, and that is not just SEND when it comes to SEND in schools, but we've got to make sure that the wraparound services around our children are properly funded, such as speech and language therapy, such as social care services, because in isolation, just putting more money into schools isn't the answer. And we have been pushing very strongly as a part of our representations to government that actually we do need more money being put into this and greater resources.
Yes, and I think that I mean, I don't have the immediate answer, but I think that if you look at the narrative around later diagnoses, improving inequalities and addressing inequalities, improving outcomes, dealing with the issues around STOMP and STAMP, avoiding that over medication, and understanding autism much better, as well as learning disability, then all of that points to a need to recognise the value of all of these therapies, the occupational therapy and the speech and language therapy. And so I think that it is being recognised. I can't say what the the response and the immediate actions are, but in local areas, I think it's really important that these discussions are had in this context of the wider inequalities agenda and the wider commitments in relation to learning disability and autism, because that is the context really within which CCGs, local authorities, social care, transition adult services all together need to be understanding all of this.
I'm very mindful of time. I think we've got time to take maybe one more question, which I think.
Actually, I just maybe as well, perhaps we could just move on to some of mine that I had.
Yes.
I had asked. So, questions from me to you, those that we haven't been able to answer, we can follow up. So have you seen your local system plans? Would you know where they are? If not, if you haven't seen them, please ask your CCG, local authority, health and wellbeing board, or scrutiny committees. I certainly had a look to find where mine had gone to, but they certainly should be. You should know about these. These should be being talked about in your area. Ask about co-production and engagement with stakeholders. How can parents and families get involved if not already? So I've given one here, one example of one that's gone out for publication that we've seen. But obviously, these need to be sort of built up from other plans, and the learning disability and autism part needs to link in with SEND as the NHS long-term plan requires. So there's actually, I've just got another page of questions. So, are you also aware or involved in health inequalities and leader work? This will all be going on in your area. I recently asked a question about this myself, and perhaps the people involved in this work don't understand the significance of it and how it needs to link across into children's services, link with SEND and the other work you're doing. If you have good practice about co-production, about learning disability and autism, we'd really love to know and see it so that we could share it. Are there any other questions about our work or specific areas you'd like to know more about? What more can we do to help you in your work? And I know you've got a questionnaire at the end, I think, so some of this might come up there, but I just wanted to, and at the end of this as well, I've put in some resource links to help, see some of the links to help you, hopefully in your work, easily get access to some of the things that I've talked about today. I've got a couple of pages of resources.
Okay, with that, mindful of time, we're going to close the webinar today. We've had a number of questions that we haven't had time to answer whilst we're on air. What we will do is we always commit to looking at those questions, and we will respond to you. Mary and I will respond to you over the next week or so, if that's okay. With that, I think we'll close the webinar. So thank you for attending today. As we close, as Mary mentioned earlier, a short questionnaire will launch, and if you could complete that, that would be really helpful for us in our planning and presentation of future webinars. Thank you.
Thank you very much.